Welcome to the deep dive. Today, we're tackling something really important, especially if you're moving from the classroom into a career. We're talking about internships,
Hmm.
and specifically in, vital fields like health information technology or HIT.
Mm-hmm.
We've all felt that frustration
Yeah,
sometimes, right? That disconnect between what you learn in theory and what actually happens day to day.
absolutely. It's a common problem.
So our deep dive today is into this really interesting research study. It's by Safdari and Ehtesham, and their whole goal was designing a system to, well, bridge that exact gap.
That's right. And the core issue they pinpointed is things like a lack of policy guidance, sometimes absence of a standardized management model, and often unclear training objectives.
Which leads to,
Well, it leads to what they call a widening gap between practical and theoretical education, and that's, not what you want in critical fields like HIT.
definitely not. So our mission here is to understand how technology, specifically this system they designed, can give us a clearer, more structured way to monitor and actually improve these learning periods. Think of it as, well, getting the key info you need on a practical solution fast. Okay, so let's unpack this. The goal was finding these essential data elements for a monitoring system. How do they actually go about that?
They used a pretty well-regarded method called the Delphi technique.
A Delphi technique, correct?
Yeah, so basically they gathered insights from 20 HIT professors in Iran, but it wasn't just one survey. It involves multiple rounds of questionnaires.
To build consensus.
Exactly, to get a really high level of agreement. In this case, they aimed for over 75% agreement for every single data element they kept. It's a rigorous way to make sure the system is built on solid, collective expert opinion.
Makes sense. So after all that, back and forth and refining, what did these experts actually decide were the essential pieces? What are the core parts of this monitoring system?
Well, they landed on a final model with 5 main data sections. It's designed to be, pretty comprehensive.
5 sections. Okay, let's dig into those. What's the first one? Management data.
Yeah, management data elements. This is really the foundation. It handles the system's core setup, including, crucially, security stuff like user access levels.
Ah, so who gets to see what? Students, instructors.
Right, students, instructors, group managers, even board members,
Oh,
making sure the access is appropriate for each role.
got it. And then user data. That sounds fairly straightforward.
It is. User data elements just covers the basic profiles of all the different people using the system, who they are, their roles, that kind of thing.
Okay, basics covered. Now, the really interesting part, tracking the actual learning.
That's the functional data, yeah.
That's it, functional data elements.
Mhm.
This is really the heart of tracking the experience. It includes things like courses offered, who's organizing them, the venues.
But also the student's input. Yes, importantly, experience registration. This is where students log the details of what they're doing, maybe in different hospital departments or settings.
So like a detailed logbook.
Sort of, yeah. Plus, report registration and evaluation features. This lets instructors record feedback and scores directly within the system.
Okay, so you've got the structure, the users, the actual activities being logged and evaluated.
Yeah.
How do you make sense of all that data? That's where output data comes in.
Precisely. Output data elements is all about reporting, generating things like comparative charts and statistical reports.
Like a dashboard.
Exactly like a dashboard. Imagine seeing maybe the performance of students or instructors, or even comparing different departments or hospitals.
So you could spot gaps, like if certain skills aren't being covered enough.
That's the idea. It allows for real-time adjustments to ensure quality and consistency across the board. Very important.
And the final piece? The key performance indicators or KPIs. This sounds like where it gets really specific about skills.
It really does. What's fascinating about the key performance indicators, KPIs, is how they've standardized the specific skills needed for HIP pros.
So not just worked in Department X, but actual skills.
Right. Detailed metrics for areas like health information management, think data storage, legal stuff for patient file coding like disease diagnosis coding, even coding of causes of death.
Wow, that's detailed.
It is. The aim is to really unify the internship training across the country, making it truly competency-based, moving beyond just logging hours to proving specific expertise.
So when you put all these 5 sections together, what's the big picture benefit? For the students, for the institutions?
Well, fundamentally, this framework offers a much more coherent way to evaluate students. It helps with self-evaluation too and proper competence-based assessments.
So it levels the playing field?
It can help equalize learners' experiences, yeah, and systematize education across the country, tackling those earlier problems of inconsistent training. Plus, that feedback loop is just crucial for students to manage their own learning effectively.
It really sounds like, as we've gone through this, they've meticulously thought through how to design a system for HIT internships. Very thorough.
Absolutely. And the researchers themselves pointed out that apparently no similar system exists with quite this level of detail specifically for internships. They suggest it could be a really valuable model.
Which definitely brings us to a final thought for you, our listener. If a detailed, data-driven monitoring system like this can potentially transform internships in a field as complex as health information technology, what other practical training areas, maybe ones you're familiar with, could benefit from a similar approach to truly bridge that gap between learning the theory and mastering the practice?